Hi there. Welcome to the Health Analytic Insights Podcast. This podcast is all about creating a community of like-minded individuals who are passionate about the field of health informatics. I hope to share information and advice in topics such as health analytics, digital health, biomedical engineering, and data visualization in healthcare. And in exchange, I would love to hear from you, dear listener, about your experience and interest in this field. You can drop me a line at HealthAnalyticInsights@gmail.com, and this email, along with any references discussed during this podcast, will be listed in the show notes below. If this resonates with you, don't forget to follow and subscribe to this podcast, as I'll be releasing new episodes bi-weekly. Before I jump into the episode, I wanted to let you know that at the end of the year, I'll be wrapping up the Health Analytic Insights podcast. I've had so much fun interacting with you, the listener, over the last 3 years, and receiving emails and comments on how these podcast episodes have helped you to learn more about the health informatics field. If you have any episode topics you'd like me to cover before the podcast wraps, please email me at healthanalyticinsights@gmail.com. Now, back to the episode. This has definitely been the year of large language models, from ChatGPT to Bard. The applications of these tools is rapidly developing, and artificial intelligence has reached most industries, and healthcare is no different. In this podcast episode, I want to investigate some use cases of how large language models might be incorporated into healthcare delivery. One of the continuous issues reported in healthcare is the burden of medical documentation into the EHR for clinicians, and I've spoken about it previously on this podcast episode, and I was first introduced to it when I read an article by Fortune titled "Death by 1,000 Clicks, Where Electronic Health Records Went Wrong" by Erica Fry and Fred Schultz. And again, I'll link to this article in the show notes of the episode, but it really encompassed some of the frustration that some clinicians might face when it comes to entering in data into the EHR and how it can take time away from working with patients. And some research papers have linked clinician burnout to documentation burnout. So this is a recurring issue that has only been exacerbated by the human resources challenges and delay of healthcare services as a result of the pandemic. We're constantly looking for novel ideas to help reduce this burden, and large language models are designed to be able to analyze and sort through large volumes of text data, and can be used as medical chatbots to help answer frequently asked questions that patients might have when it comes to protocol that should be followed when arriving at a doctor's office, or to help clients book medical appointments. These are fairly standard ways, and you might have encountered them. For example, I have a chatbot which helps me to book appointments through my patient portal. And these are fairly standard ways of using artificial intelligence in healthcare. However, with the rise of ChatGPT and Bard, the integration of these tools is starting to become more widespread. So for example, you might have seen Microsoft 365 Copilot. So it combines large language models with your data in the Microsoft Graph and Microsoft 365 apps to turn your words into powerful productivity tool. So for example, you'll be able to write something like draft your proposal from yesterday's meeting, and that can be integrated with Microsoft Notes and all the other Microsoft tools. So this is how large language models are being integrated into different industries. And it'll be interesting to see how it's integrated into the existing healthcare delivery platforms. Another use of large language models is voice recognition to help with documentation burden. For example, Nuance, a company that again is bought by Microsoft, is known for voice recognition and has announced Dragon Ambient Experience Xpress, which will automate clinical documentation by using conversational AI and OpenAI's GPT-4. So some of the benefits that this might have are to reduce the documentation burden and standardize the way information is documented across clinical settings. So instead of, everyone writing their own documentation notes, if you have one tool that is being used to standardize the way information is entered, This can be helpful when it comes to analyzing the data. And of course, some of the drawbacks associated with using this technology might be the risk to data privacy and security, and who would have access to sensitive personal health information outside of the clinical lab or facility. When it comes to translating verbal information into text data, how well will this technology be able to pick up on different accents or speech disorders from various clinicians? This technology will really have to be trained on a diverse group of people to improve accuracy. And speaking of accuracy, there have been reports on ChatGPT and other large language models creating hallucinations, which are outputs that seem plausible but are incorrect accurately. This can cause people to lose trust in the model's outputs. Healthcare already has a problem with black box models and medical algorithms, and the need for explainable AI when you're providing a diagnosis to patients when it involves these novel algorithms. Again, to reduce the chances of these models creating hallucinations, the model needs to be trained on a diverse and representative data set, which could also help to reduce inherent bias. Another use case of incorporating large language models within the electronic health record system could help to make analysis much easier. So back to the point that I said before, if we're standardizing the way the data is entered and we don't have too much variation, it can be much easier to be able to ask generic questions or queries of the data in one click. So for example, how many patients from the age of 60 to 70 have been readmitted to hospital in the last 6 months? This can help you to track clinical metrics such as patient wait time for readmission rates. And this can be done currently by writing SQL queries. But as healthcare data grows and grows, the advantage is that these tools might be used by individuals who don't have a strong data analytics background. And this is one of the beauties of being able to use large language models. People who might not have a strong analytics background can still interact with the data. Although I do think there'll be a need for health informatic professionals to kind of oversee some of the questions being asked, because to ensure the accuracy of what's being output, you really have to have a strong understanding of the data set and some of the constraints and outliers that might be affecting the questions that you're asking. So there will still need to be some oversight, but it still allows data to be more accessible by a wider audience. So don't worry, I think we're a long way from ChatGPT taking all of our jobs. But I could see the incorporating of these large language models to help with analyzing general trends or general clinical metrics across the healthcare system. And this can help health informatics specialists to work with clinical staff to develop programs to help reduce or increase certain clinical metrics and improve patient care delivery. And again, if you want to get an understanding of some of the common healthcare analytic metrics, I've done a whole podcast series on some of these common metrics, such as patient satisfaction scores, wait times. And so you can go back and listen to those episodes. So all this development has been really interesting to follow, along with, as usual, healthcare will have to lag behind other industries because patient safety is paramount and imperative. There needs to be a greater understanding of how these tools can be integrated in a safe way, in a way that best reduces bias, and with consideration to the already existing developments that have been done in the field to modernize the electronic health record. So it should be an integration into electronic health records such as Epic and Cerner. And there will need to be the right people in the room who have deep healthcare domain knowledge for the merging of these language models and healthcare to really get it right. So thanks for listening, and I'd love to hear your thoughts on this topic. It's quite a hot button issue, and so I'd love to hear how you think that these large language models will eventually impact patient care delivery, if you even think there will be an impact, and what are you most looking forward to?